We start with some breaking news, and the World Health Organization has just released a report estimating that 15 million deaths occurred globally due to the pandemic, around triple the current estimates. It has called the figures staggering. Our global health correspondent Naomi Grimley reports.
In the global chaos of COVID, makeshift funeral pyres and hasty burials around the world have become all too familiar. But have some countries undercounted the number of lives lost to the pandemic?
50% of deaths are not registered by the government as COVID-19. Our NGO brings bodies to be cremated directly from homes of victims. The government only counts related deaths of victims who die in a hospital.
The World Health Organization asked a panel of international experts to calculate the global death toll due to the crisis. In the first 2 years of the pandemic worldwide, it was thought around 5.5 million people died from COVID. But because of patchy testing, poor record keeping in some parts of the world, and the fact that some people died of non-COVID causes during lockdowns, the World Health Organization now thinks that figure might be more like 15 million.
It's a tragedy. This is a staggering number. And it is important for us to honor the lives that are lost. And we have to hold policymakers accountable also. And if we don't count, we will miss the opportunity to be better prepared for the next time.
Some countries stand out. The estimate for excess deaths in Russia is 3.5 times its official count. In India, the WHO believes deaths were 10 times what was recorded, though Delhi has disputed the calculations. In Africa, countries like Somalia only had sketchy data, so the experts admit there's a lot of uncertainty about how many may have died.
Urgently, we need better data collection systems. It's a disgrace that people can be born and die and have no record of their passing, so we really need to invest in countries' registration systems so we can get accurate and timely data.
This report confirms that places such as the US, Britain, Spain and Germany all had excess mortality rates above the global average in this crisis. A reminder that the pandemic was tough even for the wealthiest countries on the planet. Naomi Grimley, BBC News.
Well, the report was delayed due to disputes with the Indian government. The death rates on the continent are believed to be significantly higher than authorities have previously admitted. From Delhi, my colleague Davina Gupta joins me now. And Davina, the Indian government really pushing back on this report, and really it differs from the official numbers they've given.
Yes, Shalda, there has been a statement in the run-up to the release of this report by the Ministry of Health here, which has maintained that it's difficult for an international organization to accurately depict the picture of the number of COVID deaths because of the kind of geographical challenges and the record-keeping challenges. It has said also in the same length that there have been multiple consultations with the World Health Organization officials and between the government officials. There have been discussions so that they can present the correct methodology. The statement says, though they do not want to dispute the result, they do dispute the methodology used in calculating these numbers, which are clearly 10 times more than the official estimates here. The government maintains that COVID deaths were less than 1 million. So there were about 500,000, according to the Ministry of Health officials, up till May 3rd this year. There hasn't been an official sort of counting done by any agency here, apart from these figures released by the Ministry of Health, where the methodology still, interestingly, is not clear of how they arrived at even 500,000 figure.
Yeah, and that's the point, right, Davina? They're criticising the WHO for the methodology, but the Indian government itself hasn't revealed how they've come to their numbers. And the WHO says that the estimated deaths in India could be as high as 4 million.
Absolutely, and that's what the tragedy is, Yalda, because I remember reporting on the ground and speaking to people who were also quoted in the story of those people who are at the burial site, the non-government organization officials who are working to help give a dignified burial to those families who had lost their loved ones. And they clearly said that there was no record keeping of these people who had lost their lives, people who were dying in the hospitals as well. There was such a chaos at that time. It was difficult for even official record keepers to go and see what was the actual cause of death. And that's why it is crucial that the government comes at least with some clear stand on how they've arrived at their numbers and also help in preparing for the future of such kind of emergency that may arise from coronavirus if there is a continued wave here.